just start the bidding for questions. Could you, you are a physician. You are been a leader in public health schools around the country, in New York anyway, in teaching, as well as providing these services.
Yeah.
What is your sense of health being included in the decision-making for recovery by the multiple parties that are gathered together? Once you get past the initial emergency response, do you see health as being a fundamental priority in the midst of all the other things that are going on? Are they thinking about health? And if they are not, why not?
Well, I'm assuming, Reed, that you mean health in the broad sense, mental health and physical health and everything else that goes along with it, and the public health, population health. And to me, that's the final common pathway for everything about recovery. Because, you know, if you get right down to it, the reason that we care about responding to disasters and recovering from disasters is we're trying to create systems and conditions for people to live healthy, productive, fulfilled lives. And what a big disaster does is it disrupts the capacity of individuals and communities to do that. So whether we're talking about housing or the provision of social services or the reestablishment of economic strength for families and communities, it all boils down to health. And one of the things we saw after the oil spill in the Gulf was the loss of income. It's true, and that was a problem in terms of paying the mortgage. But it also quickly cascades into the realms of family well-being and the ability of families to move together, and we saw lots of domestic violence, et cetera. So we have the ripples of all the other sectors that manifest themselves with respect to health, and I don't think it's getting enough attention.
Let me push you a little bit further on that. So, by the way, it's a terrific concept, and I'm embracing this idea that health is the final common pathway for recovery. That's a wonderful quote. More deliberately, so at the end of the day, if we were to say that health is dependent upon the house being back in shape, that the mold and mildew is no longer, that the transportation systems and the income, if we were to assume those things, but can we then also assume that the people that are putting together these responses are thinking about this optimal health state as an end result and are being deliberative, or is the health a byproduct of the activity, but how deliberate is health in the milieu, in the mix of the response?
Well, you know, it's an interesting way to put this, Reed, in your question, and I think if people that are working in other sectors understood the impact on human beings of the disaster and a long recovery, that hopefully would motivate folks working in those other sectors to work as fast as they would if they were emergency responders in an emergency situation, a disaster situation. In other words, like I was saying before, the time it takes to rebuild the homes and to remove the stress of, which is horrendous, hanging over the heads of families who no longer could afford to you know, buy groceries and pay whatever mortgage they have, that stress is deeply hurtful and challenging for families. And I think if the concepts of mental health, social health, community health were incorporated into the thinking through these other sectors, that we would in fact be in a much better place. And nobody would tolerate this, you know, years and years of lingering recovery. I mean, those 26,000 families in New Jersey are suffering.
Okay.
Yeah.
Colleagues, questions? Daniel, and we'll play the card tent thing, especially because Bopper will never get a word in edgewise if we don't.
Thank you very much. I wonder if you could tell us more about the idea of resilience, which you said was present, for example, in Joplin, but perhaps lacking in places like the Lower Ninth Ward. What exactly defines resilience? Where's it coming from? And follow up to that, you mentioned before you asked if money was a core aspect of the recovery. You told us how much money had made it in, but you didn't tell us evidence-based. Is there proof that more money, in fact, speeds up the recovery process? So if you could tell us both the sources of resilience and how money plays a role.
Right. Well, let me deal with the second one first, which is that I put that as a question because I'm not sure, and we actually do need studies about that. And I don't necessarily personally conclude that it's likely to be only money. I think a much more difficult, onerous challenge here is how rapidly and effectively that money is being spent. How are the bureaucracies, the 18 bureaucracies, handling this on a federal level, and then gets more complicated as we go to states and local communities, and then actual benefits for the victims. Somebody needs to, as I've told many journalists who try to cover, for example, the 1-year anniversary of Sandy, follow the money. Follow the money. Where did it go? When did it start? Where is it going? So I think that's an unanswered question, Dan, and I don't know the answer. Resiliency, which is a really good question, is also a concept that needs a great deal more thinking about this. But in general sense, there's at least 2 levels for looking at resiliency that I would note in response to your question. The first is the idea of individual resiliency. And there's a whole literature now in pediatrics on something called toxic stress, which is prolonged, very difficult stressors that affect children to the point of long-term health and mental health consequences down the road. And that stress, that kind of toxic stress, is actually protected by what's called a buffering adult, which in effect means somebody who's resilient enough to manage ongoing trauma without a breakdown in psychological capacity to function. So on an individual level, I was going to say we sort of know it when we see it, but I think we could be more precise than that and say, how well can people sustain themselves through trauma? There are people that get out of refugee camps that do reestablish their lives, and the kids end up going to the university. There are many, many who don't. There's something, and we're still, obviously, people are investigating that. The other resiliency concept has to do with communities, and that has to do with the strength and effectiveness of social communication, social connectedness. It has to do with community support efforts that are helping those individual families most affected by those individuals who are less affected, and also has to do with economic strength of the community. So if there's the capacity for the community to come together to participate in all aspects of the recovery, if there are social support networks, and if the systems are integrated, which is the other point, meaning the health systems, social service systems, educational systems, if there is a planning process and an implementation of that planning process that allows for good system integration, we tend to see communities like Joplin that come together more easily and more quickly. If you contrast Joplin to the lower ninth ward in New Orleans after Katrina, a lot of the pre-existing conditions impair the development of that kind of social resiliency I'm just talking about.
Good morning. Thank you very much for this. It was a great presentation. Thank you for the work you've done. I guess the question that I have to add, that last slide was very powerful, very specific about what I think what either individuals or families or small units would need to have in place to have resiliency and rapid recovery. I'm thinking about, I'd like your advice, your recommendations. There's a lot of that shouldn't happen kind of stuff that we all hear about. That needs to be fixed, and we all agree with that. We've got an opportunity in this report to advise leaders, governors, mayors, community leaders, on what they put in place today for the future. So in order to allow many of those things not to happen, or at least mitigate them, what are your, given your experience, what are your top 3 recommendations that we might put in a book that a mayor might read and go, wow, we really should do that in this community? So it's proactive instead of reactive. What are the top three?
I only had two. Can I still?
Okay, that's great.
No, I don't know. Well, I think the first thing is definition of what the goal is. And the second thing, closely related to that, are the metrics that have to do with reaching that goal. So if we say the goal is something on the order of those very, very real, mundane questions that we want, that a family would be asking. In other words, if you're going to put in place a policy that is designed to help a community recover from a disaster, how do we know that it's working? What is the time frame in which it should be working? And are we asking the right questions? And so the definition and the metrics are two of the things. And the third thing would be there really needs to be more evidence-based policies and strategies. We do a lot of flying by the seats of our multiple pants, and I think that is bad news for everything about disasters, including prevention, response, mitigation, and recovery. We have too much guesswork, or this is the way we always do it, or this is the way it is, or whatever it is. And I think that as actually that concept has become a barrier in moving quickly. But I want to add to this that in the case of recovery, which by definition is some time distance from the dramatic initial event, it does not speak well for the identification of leadership. And it's the absence of authoritative leadership that, to me, is one of the biggest problems that we have. So if the president isn't telling the agencies, which I think President Obama attempted to do right after Katrina, but then, other things are happening and the attention gets lost. I actually think we need a czar for every major disaster who literally has the ability to deal with cabinet heads on the federal level, and I think that's not even as important as on the state level. Every state affected by a large disaster needs a leader endowed with responsibility and authority by, the governor to manage the process of recovery. And the people in the agencies and dealing with the sectors that are multiple, as you well know, they have to be responsible to answer to the set of metrics that end up being, are we facilitating this process for families? Like, I'd like to know why there are still 26,000 displaced people in New Jersey. What are the conditions under which they're living? Why aren't they in some sort of permanent home? And what is happening to the children of those families? And no one's really quite asking those questions. And I don't know, it's a little long answer to what you're saying.
No, it's great. Last, real quick, this will have to be short because we have to go to the next panel, but Linda, go ahead.
Thanks. It is a short question. Are there places where you think that the National Disaster Recovery Framework has trickled into a local, effective authority for dealing with disasters?
With recovery?
Yeah.
I'm hesitant because I don't know what I don't know, but what I do know is that I'm not really, Joplin may be some example of that, but I think that had to do more with the internal social and system integration and the characters of Joplin, Missouri, versus the National Disaster Recovery Framework. I'm not aware of, but I'm completely open. If somebody would like to refute that, I have no knowledge of a place where that has actually been implemented in the way we're talking about.
Thank you. Irwin, I want to ask you, first of all, just thanks again for being here. You got us off to a great start. I'm going to ask our team with Autumn and so forth to reach back to you. We would, if you could submit to us your suggestions for evidence-based policies where we're lacking.
Okay.
One of the things that we're going to be interested in is formulating some advice for the research portfolio. And it would be very interesting to see your insights on what you think ought to be in that prioritized research portfolio.
Yes.
So if you would, please, sir.
I'd be happy to do that if Autumn could send me an email reminding me to do
Oh, well,
something.
they seem not to be shy about bugging people.
That I noticed, but that's good. In a good
I've not noticed that yet. Thanks, Irwin. Have a good trip back. You're welcome to stay as long as you'd like, by the way. And we'll be drawing on you again. So we're going to move expeditiously now to the session on public health. Let me ask, did Howard, I know Howard was delayed. Howard, did you get here yet? Oh, great. Please continue on. And Bruce and Doug is on by phone. Douglas, are you still there on the phone? Thank you so much. All right, so look, here's what we're trying to get here, folks. We want to understand, for the 3 phases of recovery, something, if we can, about the funding sources for public health activities, the pathways by which they are designed to get to communities, and the relationship between non-monetary resources, things like social capital, volunteerism, technical assistance, and so forth, and how does some of that work. We hope to learn a little bit about the decision-making processes for public health activities that are either related to or independent of the funding pathways. And lastly, we want to try to get a little insight into the practical lessons learned that are relevant to maximizing health outcomes and how those lessons translate into recommendations for enhancing the effectiveness of public health agencies in the multi-stakeholder process of disaster recovery. So Howard Zucker is the first Deputy Commissioner of Health for the New York State Health Department. And Howard, thank you for joining us.